Hi, my name is Phyllis, and I will be presenting breast cancer teaching material for female of age 20 to 39. I'll go ahead and talk about cancer definition. Cancer occurs when there is a malfunction of gene growth division. This will cause a transformation of the normal cell to cancer cell, a process called carcinogenesis. Breast cancer can occur when a complex interaction occurs due to one having a virus illness, exposure to physical and chemical carcinogens, factors such as genetic history of the illness, dietary consumption of food known to cause cancer, hormonal factors, immunogenic factors, and metabolic factors. How is the female population at risk for breast cancer? Breast cancer is the prevalence cancer that affects women. It is believed that for every 1 in 8 females suffers breast cancer. According to statistics done on 2013, showed that out of 39,620 female were expected to have a diagnosis of breast cancer, while 300,000 women are newly diagnosed with breast cancer. The rate of survival has, however, increased with a decrease in the number of deaths, mostly due to the factors such as early detection, a new personalized approach to treatment, better understanding of the illness. The following predisposes a person's body to be diagnosed with breast cancer. How host factors interact to cause breast cancer. Personal history, presence of breast cancer in one breast increases the risk of developing a new cancer in the other breast or in different parts of the same breast. If you're of a female gender, and also if you have increase in age, family history of breast cancer when blood relatives are affected with breast cancer, African American population are more susceptible in terms of race, when someone has a history of benign breast disease, hormonal influence that lead to breast maturation, hence increasing the chance of cell mutation. Example will be early menstruation, late menopause, no-term pregnancy, or first child after the age of 30. Genetic factors, presence of mutation of BRCA1 located in chromosome 17 or BRCA2 located at chromosome 13. How agent factors interact to cause breast cancer. When breast cancer interacts with agents like virus, chemicals, drug, or physical agent, the cell starts to grow rapidly than the healthy cell, which accumulates forming a lump or mass, hence a breast cancer is formed. This could eventually spread through your breast to your lymph nodes or to other parts of your body. This could occur in the milk producing duct, granular tissue, which are the lobes, or other cells of the tissue of the cells of the breast. How environmental factors interact to cause this disease. When we get exposure, the environment has carcinogen, the body can produce cancer cell. This include exposure to agent like physical chemical agent, exposure to carcinogens, exposure to sunlight, excessive drink of alcohol, sedentary lifestyle, reduced consumption of fruits and veggies, increased consumption of meat, tobacco, smoking. How to self-diagnose breast cancer. Breast cancer often manifests as a solitary, painless, firm, fixed lesion with poorly defined borders. It can be found anywhere in the breast, but is mostly common in the upper outer quadrant. Signs and symptoms of breast cancer may include a breast lump or thickness that feel different from the surrounding tissue, change in the size, shape, and appearance of the breast, change to the skin over the breast, such as dimpling, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigment area of the skin surrounding the nipple, areola or breast skin, redness or pitting of the skin over your breast like the skin of an orange, This diagram represents warning sign of breast cancer. So as a person, this is how you will self-examine the areas and report to your doctor. How to get screened for breast cancer for early detection. Breast cancer screening using MRI and mammogram for high-risk patient. Magnetic resonance imaging, a kind of body scan that uses a magnet linked to a computer. The MRI scan will make detailed pictures of areas inside the breast. Breast ultrasound, a machine that uses sound waves to make detailed pictures called sonograph of areas inside the breast. Biopsy. This is a test that reduces tissue or fluid from the removes tissue or fluid from the breast to be looked at under a microscope and do more testing. There are different kinds of biopsies. For example, fine needle aspiration, core biopsy or open biopsy. Diagnostic mammogram. If you have a problem in your breast, such as lump, or if an area of the breast look abnormal on a screening mammogram, doctors may have you get a diagnostic mammogram. This is a more detailed x-ray of the breast. Treatment of breast cancer. Treatment depends on the cancer and how far it has spread. The following are ways that cancer can be treated. Through surgery, which involves an operation to cut our cancer tissue, use of chemotherapy, medicines to shrink or kill the cancer cell, through use of hormonal therapy where cancer cells get blocked from getting the hormone they need to grow, through use of biological therapy where your body's immune system helps fight cancer cell or to control side effects of other cancer treatments, through radiation therapy which involves use of high energy rays similar to X-ray to kill the cancer cell. How we can decrease risk for breast cancer. Early detection through self-breast examination. At age of 20 to 30, you should have a clinical breast exam every 3 years, and after age 40, annual exam. This is case by case depending on risk factors. If you're from a family that is high susceptible of people that have had breast cancer, that's blood related, first class, like a mother or a grandmother, an auntie. Early screening of mammogram for early detection, those from a family diagnosed with breast cancer. Prophylactic removal of BRCA1 and BRCA2 mutated cell through bilateral mastectomy, bilateral oophorectomy, or doing both will reduce risk for breast cancer. Limit consumption of alcohol for not more than 1 drink for a woman. And then limiting sedentary behaviors by being physically active. How can you get treated? Remember to discuss with a doctor about your risk for breast cancer. Remember to discuss with your doctor about any medical history and family history that might need for you to begin early screening or request for an MRI to be done along with your mammogram. For more information, you can get more information about breast cancer from the website www.cancer.org or call 1-800-227-2345 to talk with one of the cancer information specialists. References: C.M. 2015, Disorder of the Female Genitourinary System in Essential of Pathophysiology, Concepts of Altered Health Care, 4th edition, page 1017 to 1048, Philadelphia, Walter Clower. Mayo Clinic 2018, Breast Cancer Signs and Symptoms, retrieved from https://disease-condition/breast-cancer/symptom-causes/sync 203524470. Center for Disease Control and Prevention 2018, breast cancer. What are the risk factors for breast cancer? Retrieved from https www.cdc.gov cancer/breast/basic info risk factors. American Cancer Association 2017 breast cancer, retrieved from https www.cancer.org content/dam/cancer-org/cancer-control and presentation/breast cancer presentation PDF. Thank you so much.